Hello and welcome to this episode of Not a Lady, a Dr. Quinn Medicine Woman podcast. This is Kelly.
And I'm Sarah.
And this is episode 1 of season 1. Title of this episode being The Pilot, or also just Dr. Quinn Medicine Woman.
And today, I hope you're comfortable and maybe you're going for a walk. Probably going to be a long one because this is a double episode. So it's extra time with Dr. Quinn, extra time with us. This episode was originally released on January 1st, 1993. Kelly was not born.
All right, we get it.
I can only make that joke now, and then when we get to the episode where you have actually been born. Speaking of family and you being born, something I kind of threw into our introduction episode 0, was that I watched Dr. Quinn for the first time when our family lived in France, which is where you were born. And I realized I totally just kind of threw that in without the context of why our family was in France. And at the time, our parents were in language study. They were studying French because they are missionaries. So we would end up moving as a family to West Africa, to French-speaking West African countries that include Cameroon and Senegal is where we were the longest. So our faith and kind of our Christian background are definitely going to be an influence in this podcast and just kind of how we see the world and our perspectives on things. So I thought that was kind of important to mention that I didn't mention in our first episode.
Yeah, we didn't talk about that.
But without further ado, let's just jump on in because it's going to be a long one. It was directed by Jeremy Kagan and written by the creator Beth Sullivan.
Good old Beth Sullivan.
Who you have actually talked to on the phone.
That's true.
Should we tell that story now? We'll save it for another time.
Okay.
Keep you coming back. So we open the show with narration, which the purpose of the narration is definitely to kind of set us up for a lot of background information about who Dr. Quinn is, which I think on the one hand I can really appreciate. Can you imagine if, they would probably have to do a whole episode of her, background of becoming a doctor and working with her dad, but they kind of...
It's the quick version.
They clear it all up by just having her narrate for us about her past 5 girls. She worked for 7 years with her dad as a doctor, went to university. We get to see some fun black and white historic photos, one of which you can very obviously tell that they have just photoshopped
Jane Seymour's face onto someone else's body.
Yeah,
it's
for the women's college. Yeah.
He tried.
Yep. And just as quickly as we get introduced to Dad, who set up as really gave her a lot of independence, I think she uses the line, she says, he gave me, or being a doctor gave me the freedom to be myself. And then Dad dies. And they don't really tell us why, other than he's old, I suppose. We see the funeral where her mom just gives her dirty looks the whole time at the funeral, which seems kind of harsh.
And she storms out kind of in the middle of
the
wake
it's
or
not
something.
As much of a storming because there's no slamming doors, but there's the swishing of the skirts, right? You can flip your skirt around. And then we get basically that after her father dies, no one in Boston comes to see her anymore.
Without a male physician heading it up.
Which makes me...
She would have her own patients, and
she says that to her
build
mom.
a rapport with people, but I guess without...
It was improper.
Maybe. Or just because, he was a figure that was there
Respected.
for a while, that without him, it doesn't really... I don't know.
Yeah. So then we get kind of it's not really a fight, but it's a disagreement between Michaela and her mother about giving up being a doctor, and there's this whole thing it's not real, and she's like, my college degree's real,
Which you think after 7 years your mom would maybe support you?
Get over it.
Realize that
Is it because she's the baby of the family?
Yeah, I don't know. Or maybe they had issues beforehand. And well, she said, your father kind of
indulged
made you have
you.
these not false dreams, but these expectations that aren't really plausible. I don't know.
So then we get more narration where she's packing, and we learn that she is moving to the Colorado Territory, which really sets up kind of a time frame already, because Colorado is not a state yet. It's just a territory. She hugs her mom goodbye. We see the beginning of the theme. She's on the train.
Da-na-na-na. Just kidding.
Yes. You want to do the whole thing?
No.
We get this tiny little narration where she talks about her dad raising her against prejudice, but that she sees an Indian for the first time, and I forget the word she uses, but you know, her stomach was upset or feels nervousness in the pit of her stomach or something, which is understandable considering she's lived in a city her whole life.
I think it's awesome. She like freaking uproots her whole life basically to go by herself as a single woman across the country. Like I think that's pretty brave. Obviously that's pretty brave, but I think it's cool that she's like that shows her character, which follows through the whole seasons anyway, but like more than anything I think that like sets it right at the beginning of the kind of person she is.
Which I think is really why they chose to kind of do the narration, which won't stay other than just in the intro that she moved out west. But really that the meat of the story is everything that happens after she makes this decision.
So then there's this big moment where she finally arrives in Colorado Springs and she's in a rush to find the Reverend.
We meet Mr. Bray.
Which, can we just talk about this for a second? Because I have a question. Because obviously, Lauren and numerous other characters are not the characters that... Like,
Yeah.
the actors playing them are not the characters for the rest of the show, basically. Which, what's the point of that? It's just they do the pilot so they don't know... They're just trying it out, or...
Yeah, so usually what happens... This is my cinematography knowledge. Usually what happens when a show is commissioned, right? Like... A lot of times they maybe present an idea for a show, maybe present a first script, and then you'll get a production company that will say, yeah, sure, we're interested in this. And especially, this still happens today, but the way it happens is different. Back then, that makes it sound like a long time ago, in the 90s, basically what would happen is you would film a pilot episode, right? This is kind of where pilot episodes were born. And then what would happen is you would take your pilot episode into the executives of that production company and show it to them.
Hope they pick it up.
And then sometimes there's all sorts of reasons for cast changes. Sometimes, you know, they might film a pilot and then it gets picked up, but then the schedule doesn't match up with certain actors' schedules. Or sometimes the production company will be like, hey, we want you to recast this person, or we have a contract with this person, which role can they play? And so there are there's just like a lot of different reasons, but usually what would happen is the actors you have in your pilot episode are not on a contract yet for like an entire season or anything. So they would film the pilot, show it to the producers of whatever production company would say, yeah, we want this, and then they would have to go back and re-ask either those actors or their agents, or maybe they find other talent and they're like, hey, we think this is more the direction we're going, some bigger names maybe, because a lot of times pilot episodes you're not gonna get maybe the biggest names or the hottest, you know, new Hollywood star or whatever to come do a pilot.
Well, and in this, it's like Dr. Mike's the same, Sully,
Yep.
the kids and stuff. It's kind of those added townspeople characters. But I feel like I don't see that a lot now with shows starting.
So what happens now, they still film pilots, but the difference is they'll probably sign on the cast for an entire season with recognition that if the production company doesn't decide to keep it, which I don't think a lot of people know this very often, but there are shows all the time that actors film a pilot that never sees the light of day.
Right.
But usually what'll happen now is because of, you know, computers and email, like we can shoot something, send it to the production company, and overnight they can say yay or nay if they want to. But shows get canceled all the time before they've even been released to any sort of audience.
So in this case, we do see Lauren Bray, different Lauren Bray than we'll be used to later.
Yeah, basically don't get attached to any secondary characters for this episode.
Yeah, not the warmest welcome from him. Heads over to the Reverend, only to find out that he was expecting a man, which is not great, because she's literally traveled all this way, right? And he's like, oh, there's some sort of mistake, you know, and she's like,
No
my
mistake.
father thought I was supposed to be a man.
Michael.
With an A.
Michaela.
So I think it's so funny that he doesn't believe her, right? He's like, let me go confirm.
Why would this woman show up and be like, I know you think I'm supposed to be a man. Yeah.
So then they go to Horace, and
I have to
Horace...
say, before we even get to that, something I think for storytelling-wise, sorry to cut you off. Storytelling-wise, I think, so basically, with the narration in the beginning, what you're doing for your audience is really you're just telling them what's happening. You're not really showing them much of anything. Like, even the disagreement with the mother is built into the narration, is built into the, the dialogue. We don't actually see her practicing medicine. We're just told she practiced for 7 years. But something that they do well is right off the bat, she gets out of the coach, and they just have this shot where they kind of pan to her in, like, her really nice dress with her cap, which is really important, especially for, like, era accuracy. Like, women wore caps. It's just a propriety thing, which this will be a way that they also later develop and show her changing as a character. But they flash to her in all her finery, and then they flash to this shot of the mud around the stagecoach, and she doesn't say anything. She doesn't, really make a face. You just have this pause, and then she turns and walks along the kind of, like, boardwalk in front of the shops. And it really already is, like, they don't need to tell us that she's a city girl, who's not used to walking through horse manure, mud, whatever. But already we're setting this up like, oh man, she is totally out of her norm. She's totally not, in her comfort zone anymore.
The part that I actually almost missed before she goes to Horace is the best ever, because this is the first time that we see Sully, right? And then you have this moment...
Though we don't know who he is. We just see the natives and the
You don't need to know who
soldiers.
he is. You know he's important. You know it. And then, obviously, she has this moment where she completely slips and falls in the mud. And tries to play it off, right? Of like, oh, no big deal. Like,
she's trying very hard to just be fine with everything.
Yeah, like, it's fine. And that's what's so funny is this will be referenced later, but that's the first moment that Sully sees her is when she's face down in the mud, which I think's funny.
And it's not even a very, like, graceful fall. It's just,
no,
like,
it's pretty
straight
klutzy.
up right in the mud. So, historical context, she does ask Reverend Johnson why there are all these soldiers and natives kind of right there in town. And he makes an offhand comment very quickly that Black Kettle and Colonel Shivington are negotiating for land north of Sand. I think it sounds like to me in the show he says Sand Crit, but in reality the actual name would have been Sand Creek. And they're having like a treaty council, which, just some historical context here, we're estimating probably based on the fact that she was born in 1833. We get that in Boston, Massachusetts. It's probably around the 1860s, somewhere in the middle to late 1860s that the show is now taking place. About 10 years before that, in 1851, historically, there was a treaty called the Treaty of Fort Laramie, where American Indians, Native Americans, I'm going to apologize now that I may not always know the completely politically correct way to identify, but I do want to try and do my best to get the history right. But they had this treaty basically where a lot of the land in the Colorados and kind of that southwestern territory, a huge chunk of it was marked as native land. That was in 1851. In 1858, there was a gold rush, one of many. And what happened is a lot of settlers moved onto that land in search of gold. And so what began happening was native tribes began attacking homesteads, farms, all this kind of thing. In technicality, if you're looking at like the treaty, that was technically land that was given to the Native Americans. So now there's unrest between settlers and the Native Americans. People are getting killed on both ends, so the U.S., cavalry, military is called in. This treaty that I believe is happening, which actually happened in Denver historically, but it's happening in Colorado Springs when Dr. Quinn arrives, I believe is meant to be the 1861 Treaty of Fort Wise, which is where they were renegotiating this land that 10 years before had been given to the Indians. And we'll get discussions about what the military was really hoping to get out of it, but basically, spoiler alert, we do learn this later, the Treaty of Fort Wise, basically, the American government kind of took back a lot of the land from the previous treaty, from that 1851 Treaty of Fort Laramie, to the point that the natives were then limited to about 1/13 of the land that they were given from the original. So they took back all but about 1/13 of the land that was originally given to them. So I think Sully has a line later that's like, they didn't come to bargain, they came to steal, which is exactly what happened. And I think storytelling wise, we've already set up this dynamic. We see these outside, like, their groups. There's the settlers, there's the soldiers, there's the townspeople, and there's obviously the Native Americans. And then, yeah, we have Sully, who we haven't really been introduced officially yet, but he's somewhere in the middle of all that.
So then eventually, after that, they go to Horace to confirm that she's telling the truth, only to find out that Horace is the one that took out the A from Michael because he thought it was a middle initial. Horace is the local...
I don't know if you can hear it. She just tapped Morse code.
No, it's him at it's him doing a telegram.
Yeah, that's Morse code.
Okay, whatever. So just to backtrack, Horace is the local telegrapher. I don't know if that's correct. He's kind
of the mail guy.
Yeah, he works at the post office, does all the telegrams. She kind of has, I love how she just gives Reverend, like, this face of, like, yeah, I was telling the truth.
I personally really like the line where he's saying he's gonna pay to send her back, and she's like, no problem, like, I'll stay, this town needs a doctor. And he says, you don't understand, there are no respectable single women in Colorado Springs, or in this town, or whatever. And she's like, that's a shame. Every town should have at least one. Which, respectable single women, was almost the title of our podcast.
Yeah.
We went through a lot of names that came from this episode. She doesn't miss a beat in throwing that back at him. And so he takes her to the boarding house, and we meet Widow Cooper, Charlotte.
Yeah, and her kids. And Brian is so freaking cute in this. And I love how he's like, your dress is dirty.
Yep.
He's so cute.
Little Brian, Colleen, and her eldest, Matthew.
And she graciously lets Dr. Mike come and stay, despite whatever rule that she may have against not letting ladies stay there, which...
Well, she originally says there is no rule.
Yeah.
The Reverend is like, I told her you only take gentlemen boarders, which was pretty common during that day to have boarding houses that were specific to, like, a ladies' boarding house or a gentleman's boarding house kind of thing.
But it's a small town. They got one.
They have one. And we immediately make it clear in the next scene, which is dinner with the Cooper family, Dr. Mike, and some soldiers, that there are 20 men to every woman. So no wonder they don't need a ladies' boarding house.
True.
Right off the bat, we meet Colonel Shivington. He's a jerk.
It is interesting how Dr. Mike kind of all of a sudden is all brave and having conversations with not only people she doesn't know, but, like, esteemed men in the military. But she kind of straight up just asks Shivington, after messing up his title, about the treaty that's going on. And kind of, like, it's very interesting because she literally, like, moments before was saying she's never seen an Indian before, and now she's, like, kind of immediately taking the side of the Indians, defending the Indians, saying that they were here first. Which, again, is pretty brave because she has to know, like, the military stance immediately, what their opinion is on it, and she kind of directly goes against that, which is pretty, like...
And very vocally, too.
Yeah.
I also think it's interesting just because my assumption would be, like, dinner protocol would be not to discuss things that...
Politics? I think that still stands today.
Exactly, or, like, things that could immediately offend people.
But she's not worried about that.
Which I guess is another way of showing us her character and her background and her point of view, and maybe the influence of her father, that she isn't afraid to just right off the bat be like, well, I think this.
Or even that she just, just because I'm a woman doesn't mean I can't state my opinion.
Yeah, that's true. So after that evening, we get Charlotte and Dr. Quinn walking through town, and we find out that Jake Slicker, played in this episode by Irish actor Cole Meany, is the town barber. And therefore, why do they need a doctor when they have a town barber? The only two medical people you need in a town, apparently. A barber and...
a midwife.
And
which we learn is...
Charlotte. Charlotte is the town midwife.
They end up walking across town into Bray's Mercantile. where again we see Lauren and his wife Maud for the first time. And obviously they're trying to put up an advertisement for not only somewhere for living conditions, but somewhere that she could practice. Instead of being able to do that, Lauren kind of says there's not enough room. And then we switch and see Chief Blackkettle and Sully walking into the shop, where we kind of have a weird confrontation.
When Sully and Blackkettle walk in, I find it really interesting. They just like walk in like nonchalantly, as though that maybe that sign is new. Or they don't care, I guess.
They don't care. And we never really find out why they were going in there either.
No.
Like what the intent was.
Well, I'll tell you why. So that Quinn
Dr. Mike and Sully could
meet. Yeah. And of course we will learn more as we go on about Sully. But it does seem to be this moment just so that Sully can look cool, throwing his tomahawk across a very crowded storefront.
It's awesome.
To chop a sign in half.
But she's so awkward, right? She's like, let me just take this sign down, and then let me, like, back up because it just got cut in half, and then let me just, like, forget my bag and have to run back. She's just so awkward. I love it.
But I think that's the storytelling point. Like, she is so out of her depth.
And Charlotte's so kind to, like, actually help her.
Yeah, which really, I think Charlotte is really a friend that we all wish we had, and none of us deserve.
And I think part of it maybe is because, like, she is a single woman in this town. She's been there long enough to know people and know what it's like.
So they're on their way to buy a horse from Robert E. Charlotte lists off the things working against Dr. Quinn. Not only is she a doctor in this, really small town, old, kind of old-fashioned, done it the same way for however long they've been there. We also have, she's a woman doctor, and she's an unmarried woman doctor. So she's got these three things against her. We get actually some reference to time, which is, we know that the Civil War is over. And I think Charlotte makes an interesting comment that no one west really cared about the Civil War. This is some context of Dr. Quinn being from Boston, a northern state. Obviously, it's going to impact her perspective of America and of slavery and all that kind of thing. And again, this is how we know that when the story's happening right now, it's kind of between 1861 and 1865 is kind of when the Civil War happened, which is also interesting because, as mentioned, the treaty that's happened in 1861. So that treaty actually was a pre-Civil War treaty, but I guess for story, they've made it a post-Civil War treaty. So we just kind of see how certain aspects of history may be a little bit shuffled around, though are all based in real historic events.
So they head to Robert E.'s, another actor that won't remain after this episode. And once again, Dr. Mike pretends she's got it together. She knows how to ride a horse, even though she very obviously doesn't. But ends up picking a horse, and Sully is also present in this. He helps her up on the horse and then says, hey, I'm answering your ad. I have a place. Cut to, we're heading to the homestead. She's on her newly bought horse to basically a shack in the middle of nowhere.
Yeah, we never really get context to how, like, far outside the
But they definitely live outside of town. Like, they do, you know.
But how far? Or how complicated?
And also, like, how far in that time might not be that, like, you know, what does far mean? Like, my favorite part is when she takes out her little shingle, you know, and Sully says, not much of a shingle. And then, like, literally just walks away and leaves her there.
There's a couple things I really like in this scene. First of all, she's got obviously a stubborn horse, which I think is really fitting
for her personality.
Because we've seen some stubbornness, not in like a towards other people, but about like her own capabilities. Like, I'm gonna just, it doesn't matter if I don't know or I can't do this, I'm gonna be stubborn until I can or I fake it. And then when she gets down, she totally falls again.
Yeah.
And Sully doesn't even help her up. He just kind of stares at her and is like, better toughen up if you're going to live out here. Which, interestingly enough, so Sully, we haven't really mentioned, but Sully has a wolf played by actually a Siberian Husky. Gorgeous dog. But the wolf kind of like runs around her and she doesn't freak out about the wolf, which I think is really interesting because I feel like if she'd never seen...
Well, she's seen it at this point, because it was in...
But, like, that close to her face.
Yeah.
So Kelly and I spent a lot of time figuring out how much
$1
a month we estimate sometime during the 1860s, how much was $1 a month in modern day money. Based on the research we did, which...
AKA the internet.
The internet could be inaccurate, but it was about $30.
The equivalent of
the
what
equivalent
$30 today
of
would be worth.
$30 today, yeah. A lot, and I mean, not a lot, obviously, by today's money standards, but by
still, like,
then, like, that's a lot of money.
Significant
Yeah.
amount of money. But, like, a deal. Like, you know, she would have, if he obviously wasn't going to charge her a ridiculous amount. He hasn't even, no one's been living in the place. It's just been sitting there.
I was going to say, a deal for a place that's a fixer-upper.
Yeah.
For sure.
Yeah. But I like that, because the next thing that we see is that Charlotte drags her children to come help clean this place up for Dr. Mike.
And they do mention that she had to find her way back to town on her own. That Sully
She's
really
like, I ought to wring Sully's neck.
Yeah. Yeah, that he really did just abandon her out there for the first time.
But I mean, it's the best way for her to learn at this point. Like,
yeah, and that is important in the context of going to the house. We do get some of Sully's history. We find out that he was a miner, and that
during the gold rush, as you've mentioned, was already a thing that was happening, and that he did have a wife and a baby, which both passed.
Who were Lauren?
Do we learn that here?
Yeah,
I think
because she says like they didn't even act like they knew each other.
Right. Right. So it was Lauren and Maud's daughter that he married and had a child with.
Which makes us feel sad for this brooding mountain man, as they call him.
Yeah, I mean, for sure.
The next scene is cleaning the house, and again, Brian is really cute, and I think this is actually the first time Brian is the first character to call her Dr. Mike.
Yeah, he is.
Which is really cute, as he's, without permission, picking through her medical bag, which is so like a little kid.
I love he finds her little tomahawk, and she does the teller deep tendon reflex on him. I think it's...
Is that what it's called? A tomahawk? What is it called?
No, he's like, oh, it's like a tomahawk.
Right.
It's just a reflex hammer.
I also really like this scene because I'm reading a book right now that's all about good storytelling, and a big part of getting people to care about your protagonist is setting up their flaws and making them very believable human flaws, but flaws that we, the audience, recognize are a hindrance to them and sometimes to the people around them. So we see Dr. Quinn using a broom, and very quickly Charlotte notes this woman has never touched a broom in her life. And we have this thing where it's very obvious that one of Dr. Mike's flaws is that she can't ask for help, or she's afraid to admit when she doesn't know something. Which I think really makes sense if, you know, as a woman who studied to become a doctor, she can't ever second guess herself, because if she second guesses herself, then it gives everyone around her almost permission to second guess her.
Yeah.
Which I think, you don't want to do as a doctor, but also, like, in her situation, it's even worse.
And the fact that at this point, she's very aware that she's not 100% welcomed or supported in this kind of thing, so she kind of feels like she needs to prove herself.
Yeah.
So even though it's a very simple thing of just sweeping a floor, she wants to be able to prove that she's cut out for this.
Yeah. And maybe almost proving it to herself. Like that, you said, like leaving everything behind was worth it. Like there was a reason,
right? Even though at this point she's like, what, a day in, 2 days in? We're not really sure.
Yeah,
on the time frame.
I think that is a really interesting thing about this show as a whole, which I'm sure we'll talk more about going forward. But especially in this episode, it's really hard to gauge how much time is passing. Is it 2 days? Has it been a week? We're not sure. It could be either.
Yeah, I think later on she says something that, when we can talk about that later, but it is kind of hard to gauge where we're at this point in time.
So she gets some chickens and learns how to get the eggs from them, and Charlotte tells her, you know, she needs some luck if she's gonna be able to not only, I think it's not just about, like, surviving, but also, like, being a member of this town is hard. And so we get some more narration where she's kind of unpacking her things, and she discovers in the house Sully, and literally hasn't really moved anything since the day his
basically
wife
left
and baby
everything
died. I really like, she uses the word, she felt like an intruder in the house. And I think it's a good kind of metaphor for how she's feeling in this whole situation. Like, she's an intruder that no one asked for in this whole town and in these relationships, and it really seems, you know, daunting. Like, how is she going to overcome any of this?
So next we see Dr. Mike at church with the Coopers, and this scene kind of bothers me just because she's obviously overdressed, so she tries to tone it down by taking the hat off, but it's just awkward because, like, I've been in this situation where, like, you don't know anyone and your friend is there and they're trying to introduce you to people, but it's just uncomfortable and you feel, like, super awkward, and
no one's giving her the time of day.
Yeah, basically turns around when Charlotte's like, good morning, hi. And so it's just kind of, you know, uncomfortable, probably for all of them.
Secondhand embarrassment on our end, us viewers.
Yeah, I'm just like, wow, that's gotta not be fun. They don't even go to church, do they? They don't get into church.
No, they don't even get in the door because next thing you know, Hank,
our good old friendly, warm
saloon barkeep and pimp.
I feel like there's probably a nicer name for
that. He's not a madam.
Yeah. But basically, he's like, yo, I got a shot, fella. And...
That was a good accent.
Oh, thanks. That was not my Hank impression, but I think I said yo and then...
Yo. Gangster.
That was direct quote.
And she runs over just like everyone else, and they still ignore her. Like, straight up, you know, Jake, like, gets to look, and they don't even give her the time of day. They don't acknowledge her, like, I'm a doctor. And then Hank just gets this, like, women get, and just, like, chases her off with, we see standing there, kind of the...
Prostitutes.
The town prostitutes, and she just kind of gets lumped in with this, like, women, get out of here. This is a men's thing. And so they take him to the barber shop.
And she obviously follows because it's Dr. Quinn. She's not going to be told no.
She doesn't give up.
So this is where we see Maude kind of collapse. And I really like it. Dr. Mike pulls out her monaural stethoscope, which any medical student, I feel like anybody that's taken science should probably heard of René Laennec, who is this French physician who actually invented, this is actually the stethoscope that she uses here, which is, I don't see her use later in the episode, is actually technically the first stethoscope that was ever invented. And it's kind of interesting because René Laennec the reason he made it was because he was a wood carver, but also he didn't want to have to put his ear directly to a woman's chest. So
Smart.
He was like, let me just... He was a wood carver, he played the flute, basically carved out this long piece of wood so that he could listen to a woman's heartbeat, which is what she uses. And that was made in 1816, so the fact that she's using it here is good, and she uses a more modern one later. But the idea that it's monaural, meaning you just listen through one ear, so she figures out that Maude has some sort of arrhythmia, which basically just means abnormal heart rhythm. But Maude passes it off, says, no big deal, it happens all the time.
Well, and her husband kind of steps in.
Oh, yeah, so Lauren comes and is like, she's fine, it's one of her spells, let her be. Which I feel like is hard, right? Because she probably is, like, really excited that she's needed, but then it's, like,
hard
she's
for
not needed.
Dr. Mike, you mean?
For Dr. Mike, yeah.
Yeah, well, and I think this whole time, like, she's not, I think that some of the town will later see it as her trying to be a know-it-all, but she genuinely just wants to help people.
And that's what's so weird to me is, like now, right? Like, if you were to have that whole scene of, like, someone got shot and someone being like, I'm a doctor, everyone would step away.
Yeah.
But we don't have that. It's, like, the men, even if that means, like, oh, yeah, there's this guy that knows how to cut hair, that's the best next choice.
He's used scissors.
But I know that's very, like, common for this time period, 100%.
Yeah. Well, I think it's the same day, but she spots Sully visiting what we assume is his wife and daughter's grave. And they have a little conversation about the stuff that he left in the house. He doesn't really want any of it. And we didn't really mention it earlier, but when she first rode up in all her finery, Black Kettle was talking to Sully, and we see this kind of obvious that they're talking about her. And so she asks him, what did you say to Black Kettle about me? And he's like, oh, he was asking who you are. I told him you're a medicine woman. And he said, among white men, only men practice medicine. So she must be a crazy white woman.
That's what Black Kettle says.
Which is really what I wanted to call this podcast. Crazy white woman. A Dr. Quinn medicine woman podcast. But crazy white woman means something very different in 2020. So I decided not to, but I was like, she even says later that she thinks he might be right, that she is crazy. So we kind of get that. I just kind of like that exchange, actually, between them. And so we get then some time passing, we get some narration. We don't know how much time is passing. Again, it's obvious it's showing her doing tasks.
She doesn't have any patience.
So what's really interesting here too, like, well, so we see her like cooking, we see her chopping wood, which she seems to be doing fine at, but again, we don't know how much time has passed.
She's at the homestead. Matthew comes and basically is like, my mother needs your help. And we see that Emily's having a baby.
We haven't even really met Emily, other than just like she was in the crowd of
Church people
who were being introduced to.
Charlotte basically says, can't get the baby to come out. I've tried moving it, which there's a lot of manipulation you can do to turn a baby around if it's breached. And so Dr. Mike is like, let's just do a C-section. Well, obviously she doesn't say that, and Charlotte's very much like, you're not going to cut on her, are you? Which for this time period, like 1800s, C-sections weren't routinely done, and so a lot of practitioners were kind of dreaded having to do them, and they were often seen as kind of like a barbaric procedure, something kind of that, like we said before, tooth pullers or barbers would maybe do, like just to cut somebody kind of open like that was not a normal procedure. We see her give what we assume, they don't say, I'm assuming it's probably diethyl ether or chloroform, which is basically an anesthetic. And so this actually didn't come around until 1846, which there was another French doctor who had to resect a facial tumor and tried this out.
Like, pull it out?
Yeah.
Ugh.
Surgically remove a facial tumor and ended up giving a patient diethyl ether to not only, like, the point is not just to put them to sleep, right? The point is to block those nerves so that there's as little pain as possible, and by doing that, you have to put them under, quote unquote, is what we say now.
Do you think, like, the way they're doing it, like, she just poured it on a cloth and, like, held it over her mouth? Like, how much of that would you have to breathe to, like, fall asleep?
So this is what's interesting is they stopped using diethyl ether and started using chloroform, which is what I feel like we see in most of the show is them using chloroform. But chloroform actually could be quite toxic because it could cause cardiac arrhythmia. So we talked about arrhythmia before, just basically an irregular heart rhythm, which they referred to as sudden sniffer death. So to a certain extent, they actually ended up stopping the use of chloroform for that reason. So I'm not really sure. And I mean, you see in this episode, she ends up kind of stirring and awaking, Emily does, and they kind of put it back over her nose. So I'm not really sure when it comes to that, but I mean, I think that is pretty accurate of like, that's probably the way that they did it.
One thing I appreciate about Dr. Quinn that I will continue to appreciate is that while being a medical show, they don't show a lot, which I don't like. No, I don't. I know you probably would be more, but I'm like, oh, she has blood on her hand. That's all I need to see.
Which is another thing. I mean, 100% why this procedure was not usually done, because there's not a lot of sterile technique.
I mean, yeah, she pours, like, alcohol on her hands. That's
we assume to be, And so this is the thing with me is, like, first off, that C-section would have taken longer because you have to cut through that skin and fascia, but you have to cut through the uterus. It's not as cut and dry, but for the purpose of the show, it's fine.
She does seem like one cut, she's in.
Baby. But it's very, very dangerous because as soon as you basically open up anyone's skin to the environment, you are 100% opening them up to any and all bacteria getting in. And as soon as that bacteria gets into the blood, which is what we call septicemia or sepsis, you've probably heard of people getting septic. That's what that is, because if you open a wound...
Septic?
Yeah, become septics. Because if you open a wound, bacteria gets in... The cool thing about humans, right, is we're vascular. We have all this blood going everywhere around our body. So now not only is that wound in that site, but it's traveling all in your bloodstream. And this is 100% why people would probably die from C-sections. They're either going to get septicemia or they're going to get peritonitis. And what I found is that 1787 to 1876, actually in Paris, which we've established that France was a big place that medicine kind of developed during this time, not a single C-section patient survived during that time, which is basically almost 100 years. So
they were doing it, but patient being the mother, like maybe the baby survived, but not the mom.
Yeah, I guess. But probably most likely because they become infected and it infects their whole body. And after that, you're going to have organ failure and basically death. So,
which we don't even really see Emily, like, in any sort of...
Well, yeah, and that's what kind
discomfort
of...
or pain.
We discussed this, what kind of bothered me is, like, as soon as the baby came out, it's like... she wakes up and she's really happy. And, like, she would be in a lot of pain, even with that.
Which probably
diethyl
even,
ether.
like, sewing her up would have taken longer.
Well, yeah, because now you're talking about how you're going to get the placenta out. Now you need to stitch her up, all that kind of stuff. How are you going to prevent? Because right now, if you have a C-section in a hospital right now, they're going to give you antibiotics to prevent sepsis. So you're not going to have that probably at this point in time. Anyway, it's pretty cool, I think, even how she, like, the baby's not crying, not responding. And, like, Sarah was even saying, I mean, you're not a medical person, but you would know to maybe, like, slap the baby.
Oh, yeah, that was so interesting to me. I was like, I guess I've watched enough movies. I'm like, everyone knows you hold it upside down and smack the baby, but
like, that probably was not a common assumption during this time. And so the fact that literally Dr. Mike is telling Charlotte to slap a newborn baby, you know, Charlotte's like, what? But at this point, everything that Dr. Mike has said has worked and been true. And so she does. And sure enough, that baby perks right up and gets oxygen in its lungs. So yeah, I kind of like this scene because my favorite thing is she says, I know what I'm doing. And it's like that moment of, like, she does know what to do, she's doing. I think it'd be very easy in this time period, or even just in the situation she's in, not to have confidence in your abilities, especially since you've been questioned time and time again by your own mother, let alone these, you know, frontiermen. So...
And I mean, it's really the first time we see her in action, actually. So for us, even, I think it's a big moment in the show, as well as for us to be like, she's awesome.
Yeah.
Well, we get some narration that there's really been no change, even though she did this really awesome thing, but we hear, you know, this is where we hear, like, Emily and the baby, you know, everybody's healthy. So afterwards, we're gonna learn Dr. Quinn comes up with this plan to, I guess, get her foot in the door, but she goes to see Jake, to which he's not into it. I only cut men's hair, which I'm like...
She's like, okay, you didn't even let me talk yet, but thanks.
Yeah.
But she does. She tells him she's got a bad tooth. Or she ends up saying both sides, which is crazy, right?
Well, and I think as the audience, we're not even sure, like,
what's
if it's
going on,
legit or not. So we're kind of like, what? And then, well, he's got this cut on his hand, and he's reaching into her mouth.
Speaking of infection.
Yeah.
But part of me wonders if that's why she does it. Because later she gives him stuff to help with his cut. Like, did she see it and was like, the only way that I'm going to get any respect from this guy is if I let him do this thing and then I can give him the medicine.
Maybe.
I think it was more than that, but, like, as soon as she gets it pulled, that's what she does. She's like, by the way, put this on this time, you know what I mean?
Yeah. I do have to say, I think, though Colmini won't stay as Jake Slicker, I think the acting in this scene is like, you really are convinced that he is ripping a tooth out of her mouth. No anything, like, no numbing, no...
Well, and from Jane Seymour, too, right? I'm like,
no,
oh my gosh, she's
like, her face turns purple, like...
Yeah, they did a great job. But I'm just like, for her, right, she knows that not a single thing is wrong with that tooth, but she's still willing to, like, go through all of that pain. Oh, gosh. And I just love all the people, like, in the window.
Oh, they're all watching.
That are watching, like, dude, this crazy white woman.
Yeah, no TV. This is what we do. We
for
watch
entertainment.
People get their teeth pulled. I like when she's like, I entrust myself entirely to your estimable care. And he's like, what? And she's like, pull it. And I think that's a big theme, like, for this scene as a whole. Like, she is realizing she's gonna have to, I don't know that she has to do it in this way, but in a way, like, get on their level, right? Like, make herself more relatable.
Prove that she's not above them. Because I think that's probably their assumption of her. She thinks that she's much better. My favorite part after this scene is she's holding her cheek from this newly
ripped
found
out
gaping hole in her mouth. She passes Maud and, you know, says to Maud basically, like, how are you doing today? And Maud says, there's nothing wrong with me, and it made me laugh because clearly everyone thinks she's a little out of her mind.
Yeah, the insinuation is there's nothing wrong with me, but there might be something wrong with you.
Seriously. So she goes back to the boarding house where Charlotte finds out there was nothing wrong with that tooth, was there? But obviously that must have just really shaken, you know, Jake up to have her not only trust him, but have him do that.
Yeah, and she calls her, you know, fearless, or says, like, that really took guts, which I really think, again, there's this really nice establishment of this camaraderie and this friendship between Charlotte and Dr. Mike, which leads them into kind of this more intimate conversation about the men that they lost in their lives. Charlotte's husband, you know, trying for a gold mine. The gold mine was a bust. Basically,
taking her money,
leaving with her money, and just alone with 3 children, right? Like, it wasn't just leaving her, like, it was leaving their family. And so she, you know, moved out to Colorado Springs on her own. We also learned that Dr. Mike was engaged and her fiance was killed in the Civil War. I think it's interesting we have this setup that one of the things that they kind of share is we as intelligent, capable, strong women can't be dependent on men. So there's pain, there's shared grief there, but then there's also this, you know, neither one of them stopped living their lives because they lost, you know, the men in their lives, which includes, I think, even Dr. Mike's dad. Like, losing him was losing a big part of, I mean, her independence, her freedom, like, what she was doing, how she felt about herself, how she saw the world, all that kind of thing. After that, another narration, another show of time passing, and we do get a little bit of a reference to time here. She says another month passed. So we know at the least she's been there for 2 months, maybe longer.
Yeah.
But we know, yeah, at minimum, it's been about 2 months. And Jake shows up and returns the ointment, which is nice.
Which worked, he claims.
Which worked.
And then tells her, you know, hey, Robert E.'s got a case of lumbago. You know, I asked him if you could check it out. Why does... That was really weird. We had the same intonation and everything. Which part of me is like, why does he do that, right? Like, is it because he doesn't want to look at it?
Well, what is lumbago? I don't know what it is.
So basically, lumbago is just another word for low back pain, which is...
Lumbar is back?
Correct. Good job.
Oh,
wow.
I know
High five. Which oftentimes what I've found is that lumbago is caused by arthritis. So when you think, I mean, we're about to go into her seeing Robert E., but when you think about being a blacksmith, he's working with his hands, he's bending over a lot. And so...
lifting heavy metal.
Arthritis is just the cartilage that cushions between your joints is basically wearing down over time. And so you have inflammation. And so at this point, I mean, he's not that young. He's been doing the same thing, repeated motions for a long period of time. And so it's just inflamed and bothers him, basically, is where we're at. So she does go over to Robert E.'s and asks him about it. And he kind of seems like he doesn't even know where she got this information.
You're right. She kind of just says that would inflame a
case of lumbago. Basically. And he's like, yeah, it would. And so I think she actually touches him to look at it, which does not appreciate.
Well, it's not even that she touches him. He just like says, I don't want a woman doctor.
Yeah. Then one of my favorite lines from this episode happens because she says, of all the men in this town, I thought you would understand what it's like to be judged unfairly.
It's a good line. And this is post Civil War.
But also at this point, we haven't seen a lot of other black people in this town anyway.
I mean, we haven't seen any.
So that's...
other than him.
You know, I appreciate that. And she does turn and walk away. And I think that line resonates with him enough that he's like, wait, you can look at it. And so she basically looks at it and is like, yeah, you got arthritis, which I mean, there's a lot of different types of arthritis. The arthritis we think about is osteoarthritis, which is what I just described. But there could be a lot of other things. He could have like a congenital thing. He could have rheumatoid arthritis, which would lead to the degeneration of the bone in his back, which could be why he has lumbago. But she gives him...
But you could tell something was wrong with someone's back by looking at their hands?
Well, if it's joint bone related, yeah. It could be related. But again, if somebody came in with that now, you would do a lot of other testing and exams to actually differentiate on what could be a possible choice. But back then, I guess you just go off the most common diagnosis.
Maybe probably the most noticeable areas, right?
And like for him, like I said, like based on your occupation, most likely that's what's going on. And so, I mean, she says straight up, like, you can't really treat it, but I can treat you symptomatically to try to reduce, you know, the pain and inflammation that you're going through. And he seems pretty receptive. I like that scene. I think it's a good scene. And she's obviously at this point desperate for patience, desperate to feel like she's needed, desperate to feel like she's
able to contribute or can use her training and use her
that's
experience.
Why she came, you know?
Yeah. Unfortunately, the nice moment is ruined when he says something along the lines of, like, I guess that'll have to do until the new doc comes.
And she's like, say what?
And storms over
Where
on
is
her
that
horse
Timothy Johnson? Let me find him.
To go confront the Reverend. And what is the Reverend doing? It looks like he's watching, like, these women hold a quilt, or are they quilting? I don't know what's happening, but I'm just like, what is he doing? And she rides over there on her horse and is confronting him about ordering a new doctor, and he's like, he says something like, I think we all need to just calm down.
And then she's like, I'm perfectly calm.
It's a great moment, and that, you know, unfortunately, this is pretty fast moving here, because we go directly from that into cute little Brian running,
oh my gosh,
running
this
across
kills me.
the bridge saying, Dr. Mike!
A rattlesnake got her!
Yeah.
It's so cute.
We don't get context of this bite at all. All we know is it's a rattlesnake bite. She's in her bed. She looks bad. They do a good job.
Which, for me, I would be interested to know how long it's been since she got bit. Was she, like, way out of town and got bit, and now she's... Because this is pretty significant, because we see, like, she basically dies within minutes.
Yeah.
Which is not accurate. You would want to get treatment within 30 minutes, but if you left that bite untreated for 2 to 3 days, then you're going to have organ failure, then you're going to have death. It would not happen without minutes in my personal research.
That's interesting.
Obviously, this was probably very common for not just the time frame, but because they live, you know, in the, what's the word I'm looking for?
1800s?
I mean, no, because of where they live. They're, like, out in the West. They're in an area that's not really...
Remote.
Yeah. So...
It is remote.
So, obviously... You get bit by a rattlesnake, it's going to inject that venom inside of you. It's not that they're going to die from the venom, they're going to die from the fact that their tissue is now infected and is going to start to necrotize, which basically means that tissue just starts to die off.
Ooh.
That's the problem. And again, as we've talked about before, if she's bitten her hand, she's got all sorts of arteries in her hand and blood vessels in her hand that are now going to spread that venom all throughout her body. Actually,
but it's not a quick death, it's a slow, painful death normally.
That's from what I found, yes. Because you're going to have paralysis, then you're going to go into a coma, and then you're going to die. You're not just going to...
Yikes.
So it's interesting to me because they don't really show what Dr. Mike's trying to do. She asks for water, she's like running around, but she doesn't really know what to do, which is probably common because she's... Probably a lot of people in Boston are getting bit.
That's true.
You know, but usually in this time period, they would probably get ammonia and put it in the wound to try to neutralize that neutralize the venom, which they would not tell you to do now, because if you don't touch that wound, then when they get to the hospital, they can actually retract some of that venom, and they can tell you what kind of anti-venom you would need based on the type of snake and based on the type of bite and based on those things, which is important to kind of narrow down what kind of anti-venom. But obviously they don't have anti-venom at this time, so it's funny online, I was kind of like searching some things that they probably would have done to treat rattlesnake bites at that time. It's like some crazy stuff like drink a bunch of alcohol to help neutralize the venom, which really would just...
Cowboys came up with that.
Really just would increase your absorption and distribution of the venom.
Alcohol would?
Yeah. So it's also, some people were saying like, oh, just cut out as much of the wound as you can. Well, that's just gonna...
Oof, bleed more.
Right, and the more that you move, the more that you're spreading that venom farther into your bloodstream and circulating.
Isn't
so
that,
you would really
that's why
not
you
want to
make
move.
a tourniquet or whatever, right?
Right, which is also something that would have been common in this time. They would have probably tried to tie it off and stuff. But like I said, maybe you're going to want to get treatment within 30 minutes. If you don't, then things are going to start happening. But in this instance, she goes pretty quickly. Obviously, you have this big moment where she asks Dr. Mike something pretty important.
Yeah, I mean, she says, one thing, promise me you'll take care of my children. Which I guess is up for personal opinion, whether you as an audience member feel like that relationship has been earned to that point. Because that's not a small request. This is huge. I don't know, I go back and forth sometimes where I feel like, oh, I want so much more from their friendship to kind of really
validate.
Feel like, well, just to feel like it's earned, like she earned this level of trust and dependence as a friend. But at the same time, I do see areas where they really, like, she was her only friend, her only confidant, one person who really was willing to, like, stand up for her and support her. And so it is there. I think it just, I mean, it feels quick. And this is where we get into this pilot episode where really they are just setting up everything in this first episode. And the rest of the series is really just built off of everything that's going to happen after this. And because I feel like you probably could have done almost half a season, really, like, doing what they did in this whole first episode. You know what I mean? Like, they really could have like her trying to get patients and learning to survive on her own, you know, like technically, arguably, you could say that could have been half a season before Charlotte dies and she ends up with the kids. But I understand why they were like, no, like this story isn't going to be about all that buildup. This story is going to really be centered around everything that's going to happen after this. And it is, don't get me wrong, I think not only is it really heartbreaking because you have these poor little, I mean, you have the little kids, right, like Colleen and Brian, but then you're like looking at Matthew, who really we haven't interacted with all that much as a character, like other than Matthew, you know, will you do this, will you help with this, like he hasn't really said much, we haven't interacted with him much, but immediately you recognize like this, you know, boy, I think we'll learn later how old he is, but he's I mean, a middle teen.
Yeah.
Who we know has probably had to be more or less the man of the house since his father left.
For sure.
You know.
And most, I mean, kids at that age, especially boys at that age, during this time period, are pretty, you know, have skill set, have worked, have, like, done things that are pretty substantial when it comes to, like, being an adult.
And it is heartbreaking, too, for Dr. Quinn because this was the only person she really had in her corner. And she can't save her.
Which, basically, that's her first patient that she's lost since she's been there. Which, just from personal experience, is probably, it is a very, like, emotional, and not to mention it's her friend. Yeah, and it's also her friend, which makes it even worse. Like, she couldn't, you know, she has to tell herself probably she couldn't have done anything else, but, like, you want to feel like, I should have been able to do more.
Even if she couldn't do anything, you know, maybe you convince yourself that you should have done more. People die living on the frontier. People, and a rattlesnake
bite. Death is common.
Yeah, like that's just part of
life.
What happens out there, and so you don't quit, you don't give up, you just keep going. That is not to say that in the next scene we get the funeral, and we definitely see a little bit of, I don't know, there's this moment where they're shoveling the dirt onto the grave, and Matthew...
Dr. Mike kind of acts like he's going to hand the shovel to her.
And he skips her.
No, and he gives it to Jake.
Yeah.
Which is,
I don't know, it's a really weird beat. And so maybe that is their one little showing that maybe he does feel a little bit of hurt or resentment. I don't know. It's a weird moment.
But also, like, they don't know her that well. Compared to these other town people that probably know Charlotte very well, have been around, like...
We're assuming at least 2 months, maybe 3 by now. But yeah, you're right.
Which in the period of time, compared to these other townspeople that have been there, you know, have established themselves in the community, she probably seems insignificant compared to that.
Yeah. But I do like the Reverend doing the eulogy. He says, "The sorrow of loss is but the measure of a love that is stronger than death," which is very hopeful, and I like it. They don't linger on it, but I really liked it. Following the funeral, the children arrive at the homestead because the boarding house was repossessed by the bank because apparently Charlotte had debts.
Yeah. And so they're obviously not excited.
Brian says, "I don't want to live here." Colleen says, "You don't have a choice."
And then Matthew's like, "Yeah, I'm going to go sleep in the barn." Also, you should get a cow.
And it's our stuff. And
yeah,
why don't you have a cow? She's like, "I don't know how to take care of one." "Well, you know how to take care of us." And she's like, "I never claimed to know anything about being a mother."
Which is true. I mean, like, literally on Charlotte's deathbed, she's like, "I don't know anything about children."
Yeah, I mean, it seems like we have to give some graciousness to these children who just lost their mother, but I really do feel bad for Dr. Mike because she didn't ask for any of this, definitely, and she just wants to do her best, and it's really overwhelming for everyone. And, you know, she says, like, I don't know how to be a mother, I'm not a homemaker, I'm a doctor, but I think she is very gracious in the moment where she, you know, kind of looks at Matthew and is like, "But I'm willing to try. Like, can we try together?" And you see this beat where you think he is going to soften, but he doesn't really have a chance to say anything because we get Brian just running away.
Which I love this. I just love it because he runs, they run after him, and he tries to fight her, and then he's just a kid. And he's just sad, and then he just hugs her, you know? Where it's like sweet. He kind of collapses into her, and... You know, she's kind of awkward because she doesn't really
know. She has this face like, what do? I guess I'll just hold him and...
But I think that's real, right? Like
Yeah.
when you're grieving and you just want to be angry, but like you don't know how.
Well, and he misses his mom.
And he's little,
He's
like
really little. Yeah.
there's some narration here where Dr. Quinn is writing a letter to her mom and actually asks for some advice on child rearing.
Without actually telling her mother the
That she's
situation.
That she's inherited some children. But again, we kind of see that things are not going great because they're in Bray's store. Brian knocks over the candy jar, in which, you know, she tells Brian, like, you're going to have to clean this up. In which his response is, I hate you.
I feel like this line, it escalates very quickly. Like, she's not even the one yelling at him.
And
like,
also, like,
Lauren's yelling, and then all she tells him to do is, you're going to have to help clean it up.
I feel like their mom would have told him to do the same thing. So it's like, I think he's a kid. He's going through some stuff, but...
Yeah, he's hurting. Part of me just finds it odd that the older siblings also don't say anything.
They're not like, dude, you did this.
Or just, like, being rude to an adult.
Yeah.
That transitions into, we see Maud having a spell again, as she calls it, or her husband called it, and she kind of passes it off a little bit, but then she does confess that she has, like, a pounding in her chest, whatever.
Well, and I think Dr. Mike does all the right things, asks all the right questions, and gives her digitalis, which, interestingly enough, is actually something still used today for atrial fibrillation, which is what actually... I think Dr. Quinn tells her it most likely is. Whether she would be able to diagnose that, I don't think she would be able to, but
just from
it is the most common, like, heart disorder, which basically all AFib is without going into too much detail, the top two chambers of your heart are supposed to contract at the same time. The bottom are supposed to contract at the same time. When they don't, you have this arrhythmia that can actually cause stroke and death, because if your blood is not getting to your brain, you're gonna stroke out. So it actually still causes a lot of death today, but digitalis is a way for them to kind of regulate that irregular heartbeat, which it comes from a group of plants called the foxgloves.
I know those.
Yeah. So
they're pretty.
Are they?
Yeah.
I don't know that.
I saw them in Ireland.
Oh.
They look like little...
It's that's like a very big group. There's a lot of things under foxgloves.
Well, I know, like, a foxglove flower. It's a little... It literally is kind of like a bell-shaped, but it looks in a shape of, like, a paw could go in it, which is why it's like a foxglove.
Which it is pretty cool, because this plant has cardiac glycosides, which can regulate... And it's used
what
today.
Does that mean?
Well, we won't go into that. It's just basically something, like I said, that can help kind of regulate the irregularity. And it's used to treat cardiac heart failure today, as well as atrial fibrillation. Although there are better drugs. There's stuff that they would pick over this today. They would pick beta blockers or calcium channel blockers or something, but it is still used today, which I thought was pretty neat. And I like that, like, Lauren's not around, and so Maud kind of feels like she can accept some advice, some help at that point in time, because she knows she needs it. And I feel like most of the women don't really care. You know, don't you think that, like, they don't really care that she's a woman and a doctor?
Yeah, they're kind of just
it's more like the men in their life are, like, giving their opinion.
That's a good point. And that scene closes out with her actually she goes to see Horace and sending to Chicago for more
of the digitalis, yeah. Which is this is another weird, like, little medical scene, because she, like, pulls this
it's so gross
thing of wax out of his ear, which she literally uses a magnifying glass, which I don't know if you've ever looked at someone's ear canal, but, like, I don't really, unless it was actually in that, what we call the external auditory meatus, unless it was very far out in that, I don't think she would have been able
it's so gross
to do that, but I mean, whatever. I think it's funny that she helps him hear, and he's like, oh, thanks.
His reaction is pretty funny.
Send that telegram right out for you.
Yeah. Where he's like, so like, oh, I can hear.
Cut to somebody else with a medical problem. She's just treating all sorts of people today.
Which, as you kind of just said, a woman who actually calls on her and is like, you gotta help me.
And so she walks into the saloon, which obviously is not something that women do.
Actually, you pointed this out. I never would have noticed this, but right when she she, like, almost hesitates and she goes to walk in, and you see this woman walking by who, like, does, like, a full, like, turn
180.
around, like, what are you doing walking into the men's saloon? I never would have noticed that, but you pointed that out. That was pretty fun. And heads right on back, and this is where we do get the title of our podcast, because Hank, you know, says, "No ladies allowed."
In which she responds, "I'm not a lady, I'm a doctor." I love it.
It's pretty, it's strong, it's confident, and it's also, like, really embracing this whole show's theme that women are more than just what in that day and age was viewed as, you know, a wife or a mother or someone who couldn't handle anything of importance, really. I do like the little scene where even when they get into Myra's bedroom, where Myra's like, "I really like what you said about not being a lady out there," and Dr. Quinn's like, "I just can't stand male hypocrisy."
And then she's like, "What?" I think Myra says something.
Myra's like, "Yeah, me either." But you get this, like,
that she has no idea what that word means.
She just kind of agrees with her, like,
yeah.
Because she's like, yeah, she's tough and awesome, but maybe, yeah, what does that mean?
Yeah. Which I think, like, this scene is kind of how it is today. I think a lot of women are more comfortable going to women OB/GYN doctors for women issues. So it kind of works out. And then I think it's sweet how afterwards she gives her this, like, string of pearls, even though it's not real. I think that's really sweet. Really sweet. And based on what we will know later kind of about Myra's character, I think it kind of gives you a clue into even though her occupation comes with a lot of assumptions, she is, like, a very sweet and kind person.
Yeah. Which this is really interesting even going forward, like how this show that was really geared as a family-friendly show, like how they skirt around the fact that they have prostitutes in their show, right? Like, she tells Myra, "No activities." And I guess we're just assuming, like, our child viewers are just gonna be like, "Oh, okay, she can't
play soccer today." I don't know.
Yeah.
But obviously she kind of confronts Hank and is like, "By the way,
I've instructed Myra to remain chaste for a month." Which
he's like, "She works for me."
I really like this scene, and this isn't the first and won't be the last time where I feel like I would just want to be like, "Dr. Mike, there are ways you can talk to people that get them on your side, and this is not the way to do it." Like, to talk to him, like, I would assume Myra's issue might be that she has a urinary tract infection or something like that.
An STI, yeah.
So there's a way to, like, go up to Hank, I feel like, and be like, "Let me explain the medical thing, and this is how it's gonna benefit her and you in the long run if you do what I tell you to," instead of just being like, "She's not allowed to work," and then expecting him to be like, "Oh yeah,
no
sure,
problem.
no worries."
Great.
Yeah. So, of course, it escalates.
It escalates to the best part ever. Because we
have differing opinions on this scene.
You know, the guy's like, "Well, if she's not gonna work, you're gonna take her place, lady?" And they're like, By the way, if somebody said that to me, I would have been like, "Okay, let's have a conversation here."
Where I punch you in the face.
But, right, they won't let her pass, right? And it's just, like, this weird thing of, like, what are they gonna do? What were they gonna do, right? Like, I guess that's kind of scary. And then, who better to come save the day except Sully himself comes in, ready to take these guys down, right? She, like, rushes out. He takes these guys down.
Well, he pushes her out of the way.
It spills into the street as I feel like
every
saloon
fight. He throws a tomahawk
fight.
at the guy's gun.
Which is awesome, by the way. Just talk about how cool that is.
To be honest, this scene, I don't get it.
I don't have to get it. I can just appreciate Sully for who he freaking is. And the fact that they create this moment later after she gets on the wagon with the family and they, like, touch hands, and it's, like, the first thing where it's, like, he, like, came to her defense.
I think that's probably why I don't like it. It's a little too damsel in distress. And I'm like, why is he just showing up right now? Like, where's he coming from?
He was around. He heard a commotion.
He suddenly knows, oh, she's in trouble. Let me just go beat up a bunch of guys. And then they just leave him standing in the street with a bloody lip. You're a doctor. You're supposed to.
He's fine. He's not going to die from a bloody lip, okay? He can fend for himself clearly.
But, I mean, this is a woman who's been jumping all over, like, any opportunity to medically help someone. And she's like, oh, thank you. And then they just ride away.
I don't know why that's weird to you. You're not going to go to the ER with a bloody lip. It's not that big of a deal. He's fine. Imagine if she did try to be like, let me take care of that. He would have been like, no, leave. I'm good. I'm a freaking warrior.
No, I'm sure you're right, but I don't know. I guess just for me personally, this scene doesn't work for me. It's literally totally there just so Sully can look cool.
Stop saying that. Stop saying look cool. He is cool. He doesn't need to look cool. He's not trying to prove anything. He's just there. Okay? All right. Just for the record, this show is not me gushing over Sully, but I do appreciate his character and all that he stands for, and also his face. That's all I'm saying.
I told Kelly she can only fangirl over Joe Lando like once every 4 episodes.
So
this is your first quota.
But I think it is nice that they kind of rush off and they have that moment of like...
I mean, it becomes an iconic moment in the opening credits.
Yeah. I guess after this there's kind of more narration, which again we've talked about in this episode. But
I don't know that this narration is necessary. Like, I think this is one of those times where like we've talked about in this episode, they're definitely trying to set a lot up for the rest of the season. But I feel like we could have showed that Brian was still angry
without them riding back on the wagon and her being
and
like, her turning at him and he just like looks away. Like they could have left it at that.
Yeah, they could have. I agree. Which then leads right into
the next morning
when she wakes up and Brian is missing, and of course they immediately know he's run off because he's talked about it before.
Dr. Quinn, gets on her horse, tells Matthew that he's not coming, that she's going to go out and look for him, suddenly ends up being found by the Cheyenne.
Actually, well, this moment happens, I think the moment, like, cinematically, I think they do it really well, where we see her riding, she's calling Brian's name, and then the next thing you know, like, in a second, she's surrounded, and, which is certainly intimidating enough just when we think about it from her perspective, but then I think we as viewers are also like, whoa, like, why are they kind of, it feels like she's cornered.
Right. Only to find out that they actually thought she was lost
yeah,
and are trying to help her.
They take her back to the camp where Sully's there and translating conveniently.
Okay, no, stop. That makes sense. He's very close
No,
to the Cheyenne.
actually, what I think doesn't make sense is she's like, Brian's run away, he wants to live with the Cheyenne. He thinks you live with them, but Sully's in the hut!
And they're like, you're his hero. Which, yeah.
That's so.
Like, he basically does. Well, we don't actually really know if he lives with them or not.
I mean, but just from
the fact
my
that he's
assumption
there,
would be that he's in the house with them. Probably right.
In the teepee, not a house, but yeah.
But it is kind of nice, the setting up that we have seen very clearly that Sully is Brian's hero, even before, Dr. Mike arrived, because that's what he associates back when they go to the house. He associates her tool with Sully's tomahawk. So you see that. I like that connection. So then we have when she explains to Sully and Sully explains to the Cheyenne that Brian's missing, they all agree that in the morning they will go out and search for him, but they're not going to do it at night.
Which kind of tells you that she's been searching for him all day, basically, because she left in the morning. I mean, she's still in her pajamas. Yeah. So she's been out all day by herself.
Which props to her, we see, like, she's riding much better than she was at the beginning.
Yeah, the fact that she was, comfortable to do that in the first place.
Though she does admit that she was a little bit lost.
Yeah.
And I think Sully and her have this exchange about, the Cheyenne believe if a woman acts like a brave, she'll become one. And she's like, I'll risk it. Because that's basically her whole life has been, trying, almost in a way, having to compete with boy things, right?
Being just not conforming to gender norms, though.
Yeah. And then he's like, the women stay in the camp. You're not going to go tomorrow. And she's like, I'm going. And so then...
Tell me that again.
Yeah. And then they have this conversation about being homesick. This is actually a really nice scene in that this is one of the first time we've actually even seen Dr. Mike be allowed to show emotion. Like, she's narrated us through emotion, but really being able to admit, like, she feels like a failure in this moment. Like, she feels like she let Charlotte down, you know, she's supposed to take care of these kids, Brian's run away, you know, and I think she probably blames herself because they obviously didn't really work out, you know, he was mad at her for what happened in the store. Then on top of that, you know, she tried to find him, she gets lost, she, you know, now she knows he's out there alone
now she's
at
left
night.
the other two children alone for the night.
Yeah, and, you know, she's forced to, we kind of established this early on, the hardest thing for her is having to ask for help. And so here, like, even in this moment, she's having to ask Sully and the Cheyenne to help her find...
She's forced to ask.
Her kid. And then we have that prolonged eye contact across the teepee from one another, which I actually was surprised how much this definitely, the romantic tension is already built up in the pilot episode. What's the word? Like, there's no getting
Building
around that they are romantic leads, which I guess you're not surprised because they're two very attractive main characters, but...
And he puts his little shawl around her, and she's crying, and...
The next morning...
Yeah, they've got, you know, a bunch of rescue parties going out, trying to find Brian. At this point, they flash to town where Matthew and some of the townspeople, Horace, Jake, Lauren, are also kind of forming their own thing. You mentioned you're like, oh, Matthew didn't listen to her.
Yeah, I was like, Matthew didn't stay at home.
But it's the next day. She didn't come home. Like,
yeah.
I mean, even in today's time, if that happened, you'd be worried. You'd forego any instructions you were given previously. So they're forming their own kind of search party. You've got the Cheyenne search party, all looking for Brian.
Which, it's separate. You've got the townsfolk looking, you've got the Cheyenne looking, and then you've actually kind of got Dr. Mike and Sully on their own looking.
With Wolf.
And she's riding, he's on foot. Which, actually, this is really interesting, just seeing Sully's costume. Sully will get a kind of a big costuming shift, I think, in between the pilot episode and episodes to come. And a number of other characters will as well. Which we haven't really talked about the costuming shifts, but I think a good observation that you made early on is that throughout this episode, we see kind of we see Dr. Mike's costumes become more casual, become more actually in the likeness of Charlotte.
And they will to come, right? I love how later, like, in the scene where they're cleaning up the homestead, you see Charlotte in this, like, wide-brimmed hat and this, like, I don't know what to call that material. It's like Carhartt, like long, like coat. Tan, like coat. And Dr. Mike will have that on later. And in episodes to come, obviously, she does kind of adapt to her.
You know what? I just thought of something. Do you think that Michaela inherited Charlotte's clothes wardrobe when she died? Because the kids probably would have brought it with them, don't you think? I mean, this is just a assumption that I'm making. Yeah. But maybe that's actually really intentional.
What happened to it?
Yeah.
That's true.
Cool.
So...
Well, there's this moment of tension where when the townsfolk realize that the Indians are off the reservation, that they are like, we need to report it to the army, to Colonel Shivington.
Boo.
And Matthew does stand up. Well, he doesn't stand up, but he's like, hey, we don't know why. There's a whole discussion. Is it a hunting party? Is it a war party? Like, what are they doing? And Matthew kind of says, like, we don't know what they're doing. And immediately, I don't know if it was...
I think it's Lauren.
Jake or Lauren or Hank, but they're like, hey, we know, you know, your mom was they literally say your mom was an Indian lover. Which is interesting because, actually, prior to this, we don't hugely see, like, even at the dinner table when... Dr. Quinn is very obviously saying, well, the Indians were here first.
Charlotte kind of changes the subject.
She doesn't say anything, yeah, which I'm sure is because she is the hostess.
She's not trying to lose customers.
But I just find that super interesting that we find this another common ground even between Charlotte and probably another reason she gravitated toward Michaela, which was not kind of spoken on before, but we see it. So that's kind of interesting. But it does bode ill for the search and rescue party. But luckily, Sully and Dr. Quinn do end up spotting poor little Brian down kind of the side of this. I can't tell if it's a cliff or a ravine or something. But he's not moving. He is awake, though. And so Sully climbs down.
And, fetches little Brian, brings him back up. Only for her to discover that he's most likely broken his leg. Or dislocated. I don't remember what they say.
She says I need to pop it back into place, and we need a splint.
Probably just dislocated. So she does this kind of thing, which they still do today. I've seen them do in the emergency room many times today, which is what they call reduction. You're going to reduce it to put it back where it's supposed to be. Well, depending on how bad it is, what bone, what joint it may be, they would use sedation, like a certain level of sedation.
All they do is put a little stick in his mouth.
Yeah, and they just pop it back in there, which, again, I don't know. I've seen them do shoulders without that, but I don't know about if you're trying to put that femur back into the hip joint. I'm not really sure. But also, they don't show enough for me to kind of get, like, where and exactly what she's trying to do, but enough that they splint it up, tie it up.
He doesn't react, which could be that it wasn't that bad, or could just be he's a brave little boy.
Yeah.
And
Correct.
Sully's there, right?
Seriously, yeah. Can't look bad in front of Sully.
After kind of taking care of Brian's leg, they meet up with the rest of the Indian search party, and there's a beat where we see an Indian who we will later learn will become a main secondary character, prominent.
Anyway.
That Indian in particular will become a prominent named character, but we don't really get that much from him at this time. But they go to, like, check on Brian, and I guess she's getting into, like, the mothering protective stance, because Dr. Quinn's like, he's fine, and kind of, like, holds them all back. I guess she has been worried about him for a whole day and a whole night into the next day. Right as that's going on,
you have the army show up. Perfect timing. Right, and you have this moment where Matthew says, because they've joined up with them basically at this point, right?
The army's joined up with the towns part. The town
basically, because the townspeople warned the army. And he says, like, oh, that might be Dr. Mike. Like, that might be them, you know? But nope, they don't miss a beat. They're already attacking. And so the Indians are kind of
stuck. What do they do?
Right, just and run. So Dr. Mike...
Crazy white woman.
Literally, though, decides to step in front of commanding colonel of the U.S. Army.
I mean, and they're all on horseback, right? It's
like,
and these
full charge.
Like these horses, you know, they are trained, you know, to listen to their riders. But if some guy just wanted to ride her down, I guarantee those horses are just trained to keep going.
Yeah.
Like, no matter what's in front of them.
And Sully tries to stop her, but no, she says, no, you know, like, accept my apology, but my boy was lost, they were trying to help me, and they're like, okay, but they're off the reservation.
Well, it's they broke the law by leaving the reservation a number greater than 2, which is crazy. Like, when you think about that rule.
Yeah.
So unfair. On the 1/13 of the land that they've just well, actually, no, they haven't finished the negotiation yet, but we know that's coming. And Colonel Shivington doesn't look too happy about it, but he does concede to her.
He does believe her.
And rides away, not having no blood spilt, no confrontation.
Because that's the power of Dr. Quinn, medicine woman.
That's the power of a crazy white woman. And Brian, it's really cute when she goes back to Sully, and Brian, you know...
You sure told them, Dr. Mike.
Yeah, it's really cute. We are unsure if it's the next day, or this is one of those moments where it's I don't know how much time has passed, but we're back in Bray's Mercantile with the Cooper children and Dr. Mike, and there's a conversation about the carving. There's a carving there that I guess belonged to Sully's wife and the Bray's daughter, and
so it's
the first time we see Maud acknowledge it, and then Lauren kind of shuts her down and is like, hush, Maud, or whatever. Like, he doesn't want to talk about it.
Share that information. We see Maud have another spell.
Bad one.
In which Dr. Mike says, you know, where's the powder I gave you? And Lauren's like, what are you talking about? So she's clearly been able to keep that a secret.
Yeah.
In which she's out of powder. You see Dr. Mike run over to the post office, only to find out that medicine from Chicago is not in, which probably would be a very real thing for being in the middle of the West. Things take a long time to get to certain areas. I mean,
the letters themselves ordering this stuff, much less packaging the order and then sending it.
Yeah. Correct. So I think this is really hard because there's nothing she can do. I mean, modern medicine, there would be things to do, but I guess there's nothing she can really do. And so Maud passes, which is really sad, actually. Lauren's like, Maud, no, Maud. It's just sad. And I think for Dr. Mike, it's another one of those moments. The same thing with Charlotte where it's like, you know, you've lost a patient, you've let people down. I think that people think that that doesn't affect providers. It does. No matter how many times you see that, it's difficult. And so I think that's pretty hard for her in that moment of, like, she's lost another patient based on the fact that, like, if she had had that medicine, had she been in a city on the East Coast or anywhere, like, she would have had access to that, but she didn't because of where she's at.
Which is a first time experience for her, for sure. And, I mean, that's the second patient in a row, basically. Something drastic where she hasn't been able to do anything.
Right.
And, you know, where she thought she was helping Maud, and in the end it was, I don't know, like, what would the difference have been? She basically maybe bought her more time, but in the end there was still, like, she died from it anyway, I guess.
Yeah.
Back at the homestead, we're seeing a family dinner, and a letter has arrived from Dr. Quinn's mom, and it's a harsh letter.
It's
not
basically
really
like,
nice.
Move back home.
You were raised to be a civilized woman, not some rustic.
And, like, if you want child rearing information, then you should just come back home, get married, and raise a family.
Yeah.
Like,
it's really harsh. Which, we've only really seen one interaction between the two.
But I think this is probably one of the first times the children see her emotional.
That's true.
And, like, it's from a place of probably, like, homesickness, but also just feeling like she'll never be enough. Also feel like she's a failure, you know?
Well, and on top of this, I think here's the kind of climax of that picking out of her flaws. Like, what did I say, like, earlier was her biggest flaw?
Not being able to ask for help.
And she asked for help. Like, she asked her mom for help with raising these kids, and it got thrown back in her face in a really harsh, really... And like, her mom obviously didn't know the circumstances, but it was just...
But doesn't even inquire.
Like, you know how crushing this is, because this is her thing. She has trouble asking for help, and she did, and she asked for help from her mom and got denied.
Yeah.
So, you know, when you see her just kind of break down, and, you know, all the kids are just there, and it's just, it's really, it feels really real.
So then that night...
We assume it's that night.
Sully, banging on the door, brings in Black Kettle, who's been shot in the neck.
Yeah, before we jump in with this big medical moment, I want to talk about this historical moment. So this is what is still known to this day as the Sand Creek Massacre. November 28th, 1864 is when this happened, which, connecting to, actually the timing of this, as far as like the time of year goes, is right, because we learn from the mother's letter that it took about a month for the letter to get to the mom. By the time she wrote back, she said it was going to be another month. So she's like, by the time you get this, it'll be November already.
And that's assuming that the mother wrote and sent the letter immediately.
Yeah, and so the Sand Creek Massacre did happen November 28th. It did involve Colonel Shivington, as well as Black Kettle was not the only Native American leader who was present. 8 Indian leaders would end up being killed in this massacre. 133 would end up being killed. Of those 133 being killed, 105 of them, they say statistically, were women and children. But Shivington would later actually claim and brag that he had killed 500 to 600 Indians in this massacre. And basically, the short version of this massacre happened right after a peace parley in 1864 in Denver, which I'm not sure if that's meant to be a part of this treaty that was happening, that we've learned now that they've taken away most of the land. We've had Sully, do his line where, the army didn't come to trade, they came to steal. But those that were killed, all the young warrior, aged men were out as a part of a hunting party. The Indians were asked to move, they didn't move, and basically Shivington took it upon himself to go in the night and attack. What's super, awful about this is, Black Kettle had even been told to fly a U.S. flag and a white flag of surrender under. I don't know if it was meant to be, as protection, or the point is Black Kettle did what he was told to do by the army, and they ended up attacking and butchering all these people. 133 Indians were killed, 4 soldiers were killed, and they're pretty sure the ones that were killed by friendly fire due to drunkenness. So there's this horrible massacre that we don't even get to see that is the backdrop of Black Kettle being shot in the neck, which is not, I couldn't find any reference to him actually being injured. He actually was one of some that escaped. But I think it's definitely an interesting tie-in because the army then did go looking for those who had escaped to, I guess, more or less finish what they started. So pretty gruesome. Just an interesting thing, if you've seen, this is where I'm going to show like my generational thing, but if you've seen Iron Man 3, the Mandarin, the villain in Iron Man 3, as part of his terrorism campaign, actually talks about the Sand Creek Massacre in his video message to the president. So if you've seen that movie, you've actually heard of the Sand Creek Massacre even before now, which I think is super interesting that this is still a very relevant historical event. That being said, we have Sully and 1 or 2 other Indians with him carrying Black Kettle into the house, just putting him on her bed.
Yeah.
And he's got a bullet in his neck. So talk us through, what does this look like medically?
Well, I think there's things like this where I'm like, I guess it would depend where the bullet hit, because you have a lot of vasculature in your neck, including, everyone knows, right, your jugular and your carotid come right across. You don't have to be medical to know that.
That's like game over.
Right, so it would be interesting because when she starts cutting it out, I'm kind of like, I don't really know. It's hard to tell the location, but she's more concerned because the swelling from the bullet in his neck is actually constricting his air passage. And so she decides to do a tracheotomy, which is true that tracheotomies that is one of the main reasons that they would be done, to kind of bypass some sort of air blockage or constriction so that he can breathe. Probably his oxygen will be cut off from his brain before he's going to die from the bullet being placed, or at least that's what they make you believe.
Right.
The only thing I don't like is she doesn't feel, like normally to do a tracheotomy, you would have to feel for the Adam's apple. You would have to go below that. There's the cricothyroid cartilage, and right above that, there's kind of an indentation, and that's where she would be doing the incision on that anterior neck, basically to create an air passageway, and and a direct airway to the trachea. But she doesn't feel for it, which maybe we just don't see that. But
it's also really dark in that room.
And also, like, she didn't have a plan before of like what to put there to allow the air to escape. Like, she's like, oh, by the way, like, oh, crap, now there's a hole, like, a feather? Great. Which is fine. I think she's actually, for not being on the frontier before, like, being able to think on her feet like that and kind of come up with things and ways that are not conventional is pretty good.
Yeah.
So I thought that was pretty neat, but she then cuts the bullet out.
What was she gonna give him for the pain?
Probably diethyl ether.
Okay.
But he doesn't want it, which again is pretty, and it's also pretty risky to just like put a knife in his neck, but she gets it out, and then there's kind of unclear of like if she stitches it up or...
Well, it seems like she waits a little bit for the swelling to go down before she does.
I'm talking about the neck wound.
Oh, once she gets the bullet out?
Yeah, because he's probably still actively bleeding, especially if you've now removed a thing that was probably stopping the bleeding from happening. So,
did we mention that I'm, like, not into blood and guts at all?
Although, I was, like, interested in, like, is that actually something they would have known at that time? Which apparently, tracheotomies was something that you can point back to 3600 BC.
Wow.
But apparently from 1500 to 1832, which would be before this, there were actually only 28 reported cases of a tracheotomy, which just because they're reported doesn't mean that other ones didn't happen. But, I mean, it probably was still a pretty... I mean, it's very common in today's time because that's how any sort of tracheal tube is placed. But, I mean, it probably wasn't a procedure she had done a lot before.
So she gets through it, and then it's just kind of a waiting game for a little while, which is a nice break from the, I think this show does a good job. We get action, we get high pace, and then they do give us some breathing room, but we've had high emotion to, this major emergency, and then we kind of just get this nice breathing moment, really just for Sully and Dr. Mike to kind of really have this conversation where she asks him the question that kind of we all are wondering, like, how did you get so involved in this? And this is kind of the first acknowledgement we get of Sully of his relationship with his wolf. And I really like his little, I don't know if it's a speech or his story about the wolves and about how there used to be hundreds of wolves, and then white man came and put a bounty on their heads, and now there's so few left. And how he kind of sees it almost as this foreshadowing of what's going to happen to the Native Americans, which is, it's so painful even to imagine, like, that kind of recognition, but also just him watching it and still choosing to be involved and choosing to care about these people so deeply, to which, I mean, what are his ties? I mean, they took care of him, they're his friends, you know, but we don't know much more than that.
Yeah.
I don't know, as a viewer, like, even now when I look at, you know, the historical trauma of Native people, when I look at the buffalo, right? Buffalo or wild mustangs or, you know, and I mean, all sorts of, like, conservation efforts, and I'm like, ugh, humans are the worst, right? Like, but yeah, especially, like, the impact that colonization or just efforts like, yeah, like gold rushes or, you know, any sort of, and that's not to say all settlers were evil, but that there's definitely this movement of, I want this thing and I'm going to stop whatever gets in my way from obtaining it.
Right.
So, I don't know, I like that scene, which transitions into, they have moved Black Kettle into the barn. They really want to leave now because they know that the U.S. Army is going to be looking for him. So she kind of gives this hint that she really doesn't want to move him, at least for a day. She talks about, wanting to stitch up, I guess, the tracheotomy.
Yeah.
But she has to wait for the swelling to go down. And then, of course, right as they're having this conversation,
The army
shows up.
Which cracks me up because she's like, she feels the need to disguise herself. I guess because at this point they know she's a sympathizer based on the fact that she, I don't know, stood in front of the whole army and decided to stop them. You know, not to mention the conversation at the boarding house. There's been numerous times at this point.
Oh, that's a good point. I never thought about the boarding house.
Shivington 100% knows who she is. Whether his men will know or not, that's one thing. But
it's not that
she
big
kind
of a town.
Correct. And she kind of, you know, gets an accent, puts a shawl over her head and pretends she's
southern accent.
Can I help you? In which basically they're like, there was a massacre. Have you seen any Indians? No Indians around these parts.
Actually, do they say there was a massacre or they just say we're looking for
Oh, they probably didn't say massacre.
Yeah,
they probably just say we're looking for Indians. So they search the house, go to search the barn. Basically, I think Dr. Mike and the kids are freaking out because they're like, they're definitely in there, so they don't know what's going on or what choices they're making.
But Sully's on it.
The barn is locked. We see them kind of get Black Kettle out. He throws his tomahawk to basically cut a rope so that the door will open.
Yeah. Just
in the timing that they're leaving the back door, so...
Which it's very cool, and it's good because it gets them inside so they can escape kind of out the back to the woods. We do find out they don't actually leave, but they just get off the property. But my thing is, wouldn't you, as a soldier, find it suspicious to find what I would assume is an authentic Indian tomahawk in their barn?
Which obviously they didn't look hard enough, or that's the assumption, but...
But I feel like that would be a clue.
It's
like,
a
there
reflex
have been
hammer.
Indians here. Oh yeah, I guess you think they'd believe that?
No.
Yeah. So they get away with it.
Yeah.
And the soldiers leave and are none the wiser, so it all works out.
And they come back basically with Black Kettle. We
assume that she finishes
for a while.
stitching
it up. I guess. They lend their horse so that they can get him out of there. They don't really say where they're going.
On the run.
Sully makes a comment about how Charlotte raised her children well, which I think was probably nice. Especially, again, I just keep thinking that Matthew's at an older age where this probably affects him in a different way than Colleen and Brian, and so that's a nice thing.
We also do learn a little bit. We get another glimpse into
Sully's background.
Maybe I don't know that you could term this as a flaw, but maybe a weakness.
What's his only flaw?
This is it's not a flaw, it's a weakness, because so far he's just been macho superhero. Awesome. Sully's weakness, he's afraid of horses.
Yeah.
So good to know he's human.
He is.
And then we get another time jump where we're not, well, I guess it's not, we do know how much time has passed because we know the massacre and the letter came in November, and so suddenly we jump to Christmas, which I guess we didn't mention when they were shopping. They did mention there was a Christmas dance that Colleen was looking forward to and was going to make a dress, and of course, in good Colorado authenticity. They are snowed in and are unable to attend the Christmas dance.
But 100% what they do is what I probably would make our family do, which is everybody still get dressed up. We're still acting like this is a big deal.
Yeah.
Even though there's kind of this somber tone of Colleen's sad.
Colleen's heartbroken.
She's sad. Matthew's annoyed because he doesn't want to be in these clothes.
And Brian wants to be like his brother.
Yeah. Dr. Mike does a good job of pointing out that that's not what Christmas is about. It's not about parties or, trees or decorations. It's about family and being together.
And then she forces them to sing Christmas carols, which...
So cute, though.
No, my favorite part of that, whole scene is when... So Colleen starts to sing, Brian starts to sing, and Matthew's not singing. She gets in his face singing, and then he starts to sing, and then they start a new song.
And he stops.
And he stops singing, and she gets in his face again, and then he starts singing. I'm like, that's such a mom thing to do, right?
Yeah. But I don't think it's that forceful, but it is he's not
funny.
that into it, which is probably realistic for a teenager.
Yeah.
But they sit down to eat, and there's this
And they have a nice feast.
Which she didn't make. Colleen was probably all over that.
Yeah.
But I think it's so sweet because finally Brian says, do you think my real ma would be okay if I called you ma too? I think you point out a good thing. She looks at Colleen and she looks at Matthew kind of for permission before she's like, yeah. And they both nod.
Yeah, it's a nice beat where before answering, she's kind of looking to them to see how they'll feel about it, which is really, it's thoughtful and also very gracious of them and all of the relationship there, right? Like there's a bond there of this is not just her decision, it's a family decision.
And they are a family, and I think that's so nice that then she says, I don't think she'd mind a bit. And so now she's gone from Dr. Mike to, or Brian at least.
You know what, that's really interesting because as far as in the show goes, Brian is the first that we hear call her Dr. Mike. And he also then is the first one
to call her ma.
Which is really, it is sweet.
It is.
And we know we haven't seen Sully for a while.
She says, in the little narration part where it's snowing, we didn't see Sully after that. But
boom,
he shows up
as the abominable snowman.
No,
in fake snow.
Oh my gosh. Well, anyway, the knock on the door and it's who would literally be out in the middle of this blizzard? And it is Sully, and he immediately kind of comes in and pulls out this cute,
to die
fluffy little puppy for Brian, which is just. How long did he carry that? So sweet. But he has gifts for everyone, which is could you love him more? Right? He gives Colleen this comb that's obviously carved from bone or something like that. He gives what we assume is kind of like a pocket knife to Matthew. And then, of course, he gives Dr. Mike. Now that's a shingle, which is beautiful. And I think
it's a great nod back to their first
one of their initial interactions. But I think it's sweet because, without spoiling too much, there will be future episodes in the season where Sully's more present in their family's lives, and this is kind of the first showing, especially since she invites him to stay for dinner, and he does, and it's kind of like they've had this moment where they've kind of established that they're a family, and then Sully is invited to stay, which is pretty neat.
We both, laughed. Here's our Disney throwout, right before she's about to invite Sully to stay.
We're watching the episode
for
together.
dinner. Would you like to stay for dinner?
And it freaked me out because literally in my head I had the exact same quote, and I literally was about to say it. And then she said it. It's from Mulan, for those of you who don't know.
And it's followed by the grandmother going, Would you like to stay forever?
Which is also how I feel. But it was just really freaky that Sarah said it, and then I was literally I had the same exact thought.
But instead she just says, eat with us, with a question, as he's getting ready to walk out the door.
Oh yeah, maybe I don't want to go back into the blizzard. I guess I'll stay. Hope you don't read into it or anything.
Oh gosh. That would be what a 2020 boy would say.
But that's kind of the...
Well, then there's some final narration to kind of close out the episode where she talks about, which really, because this was a pilot that could have never seen any continuation, but maybe could have become an independent movie if they really wanted, right? So it kind of just ends with, what she got for Christmas was a home, family, and love. And everyone goes, oh.
But it is nice. I think it's a nice, like, things are not going to be perfect. She still is going to have to learn a lot, but a lot has happened. She's gained things. I don't think she ever thought within months of coming there she would have children, have done the kind of procedures and treated the kind of people that she anticipated.
Or even just, learning how to, like, survive on her own.
Which is totally what I want to do, like, when it comes to, like, medicine in a lot of countries overseas. Like, you have to do that. You have to find other ways to make things work. One, for expenses, but also because you don't have the availability for a lot of, not just drugs, but, like, equipment, all sorts of things. So I don't know. I think it's awesome. And she does. She just shows up on her toes and she does it. And it works out, but it also doesn't. Like, I'm glad they don't make every single patient in this episode, like, survive. Because that's not real life, especially for this time period. Or a frontier doctor. Like, it doesn't matter if she's a man or a woman, right?
Yeah. Like, a frontier doctor already had, the stakes are higher.
Yeah. And that kind of closes the first episode.
Yeah. So, couple things we're gonna try and do at the end of every podcast. Do you have a favorite scene?
This is hard for me because one, it's a lot happens in this episode. Okay, hate me or not, but I just really like the scene where she's coming out of the saloon and this confrontation happens. And Sully shows up, and I'm not saying I like it just for romantic purposes. I think it's awesome because he's just awesome. But also, I don't know why. Shut up. I like the part where they just they jump in the wagon, and he not only protected her, but showed up, defended her, and then they have this moment where they touch hands. It's like her way of saying thank you, and his way of being like, you're welcome, I got you. Which is just nice, because she's going to show up for him later in the episode in ways that he wouldn't have been able to show up. And I think it's just a nice way of, like, starting their relationship, and that it's this weird thing, but they trust each other for some weird reason.
That's totally fair.
Yours? What was your favorite scene?
I think I actually really like Sully's speech comparing what's happening to the natives to what happened to the wolves, and how he's gonna do whatever he can, to take care of the things he cares about. Which I think speaks a lot into, especially us knowing that he's lost a lot in his life, that now he sees life more as just, again, kind of in a similar vein to her story, that it's not being like everyone else or sticking to the status quo or, just conforming to this is what you should do.
Right.
But taking his hardship and taking the, the pain he sees in others and being like, I'm gonna live better.
Why, he's the best.
So, last thing that we're gonna do, which really isn't gonna be a huge part of
today's episode,
but I would really love to begin ranking our episodes. So, obviously,
this is number one,
This
baby.
is number one, so it's gonna go as number one on the list. But I'd like, especially as we go through this season, to kind of start ranking the episodes and, looking at, I think, plot-wise, there's a lot jam-packed into this first one. This is a long episode, and there's a lot that happens, and most of it is literally just setting up everything.
The entire show. So first off, thanks for sticking with us, because this is definitely a long episode. Appreciate you guys if you're still listening at this point. Props to ya.
Yeah.
It's probably just our mom at this point. Actually, probably not.
Mom probably bailed after the first half an hour.
That's exactly what I was going to say. But we do want to get some of your guys' feedback, some listener responses on what was your favorite scene, what were some of opinions on the episode.
Or even if you have memories of the first time you watched this episode of
I would love to hear that.
And felt. How do you feel about Sully showing up in the nick of time and being...
And if you disagree with me, that's totally fine.
No, here's the question. Is Sully cool, or does he just do things to look cool?
Please, tell me, because I need Sarah to know that she's wrong.
I do like Sully. Yeah, and I think a big thing that I would love is, we kind of touched on seeing character flaws, character growth. Like, if you have any thoughts, anything that you think we missed, or ideas that you have, we would love for you to share them with us, and maybe we will be able to talk about them on a future episode of the podcast.
Definitely.
Next time, we will be doing Season 1, Episode 2, which is titled Epidemic.
Which is quite fitting for the times that we are in.
Fitting or traumatizing.
Probably both. Like this, so.
We all can relate to the epidemic.
Seriously.
But we will talk more about that next time. And we hope you'll come to listen again. We appreciate you
for spending time with us sisters.
And if you like this episode, you can support us by liking or sharing our content on social media. Be sure to visit us at our website, www.notaladypodcast.weebly.com, or visit us on Instagram or Twitter at Not a Lady Podcast. We look forward to hearing from you.
Bye guys, see you next time.